Hi everyone, Buğra Bakan here. As part of my educational um, series, I'll today discuss Medicare planning. Even though you may feel you have 10, 15 years to retirement, I think it's good to have at least a basic understanding of what's ahead um, as far as healthcare planning goes at retirement. And if you are within the next 2, 3 years or even 5 years, I think you should definitely pay attention to this presentation. If you are retired, you certainly should. So why did I put this together? Because there's a huge need of going through what Medicare is all about, its terminology, and what that entails, because there's not much education out there. Um, you don't talk to your CPA about this. You don't talk to your insurance person about this. You cannot talk to your HR about this because they don't know. So financial advisors are now in a unique position to go over um, this part of your retirement planning. So at the age of 65, US citizens and green card holders, we qualify for public health insurance, which is called Medicare. It's extremely complex. I'll barely touch the surface, but believe me, it's enough. You'll have much more information than 90% of the people out there. Um, and it's extremely important as far as the retirement planning cash flow projections are concerned, because it can be a huge bill. So I will today discuss, as I mentioned, the basics, let's call it, of Medicare. Um, what happens is many people have health insurance through their employer-sponsored plans. And transitioning into retirement, that stops because you're no longer employed. But if you work at a place with more than 20 employees, your company is obligated by federal law to offer you COBRA, which is good for 18 months. But if you work for a company with less than 20 employees, it is not mandatory. So if you are a small company and if you think you may have COBRA, it might be good to check. You may have it, but it's not mandatory. And what happens is there's no COBRA after 65. So let's say you are 64 and a half years old and you're waiting to waiting to retire, can't wait, and you're thinking your COBRA will get you through 65. It doesn't. So let's go through signing up, when to enroll. My actual birthday is October 19, so I picked that. Um, and if I were born in 1959, so next year, 2024, October 19, I would turn 65. So when do I sign up? The window, as they call initial enrollment period, which I highly advise everyone takes advantage of, and I'll get to the reasons why. It's a 7-month window, 3 months before the month of your birthday and 3 months after the month of your birthday, and including the month of your birthday. So it's 3 plus 3 plus 1, it's 7 months. So let's take my birthday as an example. 3 months before October is July. So the first 3-month window is July 1st through September 30th. The second window is October 1st through January 31st, which is the 4-month including your birthday. So if you sign up July, let me see if I have it covered here now. If you sign up July through September 30th in the first 3 months prior, your Medicare coverage becomes effective in the month of your birthday. If you miss that window, anytime in the next 4 months, if you sign up, the month after, the first of the month after, your enrollment becomes active. How you sign up is through SSA.gov. Social Security Administration manages the money flow and enrollments of Medicare. This partly makes sense because if you also get retirement benefits, the Medicare part gets deducted, so you get a net. So why do I go through the initial enrollment period and I highly advise you sign up? Because Medicare Part A which covers hospitalization, limited skilled nursing, home care, and hospice. There's no premium. So there's a difference between there is no premium and it is free. It is not free. You still have co-pays within Medicare Part A when you're hospitalized, but you don't pay premium. So there's no downside to sign up for it. If you have a group policy at work, or if you're covered, like myself, lucky me, through your spouse's group policy, because my wife has a good insurance plan, I'm on it, I would still sign up. Why? Because there's no downside. This would open up the room for, as insurance industry calls, coordination of benefits between insurance. Who pays first depends on circumstances. Sometimes Medicare is the primary, sometimes the group policy becomes the primary insurer. It depends. I won't make a call here. But let's say you missed the initial enrollment period and you're working, you're confident. Well, anytime while working, if you're past 65, or 8 months of the day after, or 8 months of the day after coverage stops. That's your window. In other words, if you miss the 8-month window of the day after you stop working or the coverage stops, you miss this window, which is called special enrollment period. When does your Medicare start being effective? The month after signing up. So if you miss the initial enrollment period, you should definitely take advantage of the special enrollment period. Now, if you miss both of them, now you're in general enrollment period, which is pretty much the first 3 months of any year after turning 65. Highly advise not to do this because lifelong penalties will likely apply. So we went over Medicare Part A, which is hospitals, and the Medicare Part B covers outpatient doctor's visit and preventive health care. So Medicare Part A is not enough. When you sign up Medicare Part A, it does not have premiums. Great, but as long as your cash flow allows, you shouldn't stop there and add Medicare Part A and other parts of Medicare I will get to in the next slides. For this year, an average, and I say average, most likely monthly premium is around $165. The reason why I don't make definitive statements because premiums may change based on your income. But it's about $165. It gets deducted from your Social Security retirement benefits. If you are, let's say 65, 66, and you are one of those lucky people want to push the retirement benefits to 70, then you just have to write a check, gets debited from your account. So Part A and B, you should definitely take advantage of because you're still in the government health insurance habitat. Now, you took care of your hospitals, you take care of your doctors. If you can afford, you should still look into supplemental private insurance because, as I mentioned in Part A, there are no premiums, but it's not free. You have high deductibles, you have co-pays, you have co-insurance, and no out-of-pocket maximum in Part B. So when you factor all this with co-pays and, for instance, that whole no maximum Part B has 20% co-insurance. It's significant. If you have a huge doctor's bill, let's say you had a major surgery and you have $80,000, that's $16,000 co-insurance. And again, no out-of-pocket maximum. So it would be good to have a supplemental private insurance to take care of your deductibles and other points that I just mentioned. And they are called Medicap, Medicare Advantage Plan, and Medicare Part D. The terminology gets more and more confusing but that's the nature of this beast. So now we are stepping out of federal health insurance programs. Now we are in private. Medicap is a private health insurance. That being said, it is highly regulated, like the industry we are in. We are a private company, but we are highly regulated by SEC and other regulators. So the good thing about Medicap is that there is no medical underwriting, so you cannot be denied as long as you use the first 6 months of signing up with Part B. If you have pre-existing conditions, obviously this is great, but this is a once in a lifetime window. Again, this is why understanding Medicare is so critical. If you fall asleep on the wheel, I'll get to it. I'll take care of it later. After 6 months of signing up with Part B, that window closes. If you miss that, I'm not saying they will deny insurance. They get a chance to do so. They may limit your coverage. It may be more expensive because remember, now you're in private insurance zone and we know how they are. I'm not a big fan of insurers, but anyway, you don't need to know that. That's my personal opinion. Doesn't count. Scratch that. Let's move on. So the Medigap premiums on average, again, based on your income, it may change. This year is $155. Is it significant? Is it not? Depends, obviously. For some people, it's a lot of money. And does not have Plan D drugs coverage. A new term enters here, Plan D for drugs. So I would add that too. So now that's another $31, $32 to your insurance. Part A, hospitals, Part B, doctors, Medigap, and Part D. Now you're covered. Let's say that's a bit expensive. You don't want to go that far. There are also Medicare Advantage plans. So these are, again, private insurance, health insurance offerings, and they are designed to pretty much replace Medicare, period. They come in HMO and PPO packages, as we are all familiar. Obviously, PPO is more flexible with your providers. HMO is more of a Kaiser type of a plan. And as I mentioned, they're designed to replace Medicare. Now, why would you consider this? For a couple of reasons. One, much less in premiums. It could be $14, $15, $18 as opposed to $150, $60. And if you get rejected by Medigap insurers, Medicare Advantage plans, you may find a solution because now you're on a much wider network of insurers. You may be able to find a hole and get through that with your pre-existing condition. And they do come with drug coverage. If you have a specific drug for a specific condition, I would see if it's included, if it's covered. Which one is better? It depends. If you have the cash flow, Medigap, period, by far. Medicare Advantage plan, it's okay. But there's a reason why there's that much of a price difference. So Medigap, I just tried to outline here. Part A is mentioned $0. Part B, 165. These are estimates. With Part D and Medigap itself, it comes to about $352. And Medicare Advantage plans can be anywhere between $15, $18 or more, depending on the package you pick, obviously. So I would basically look at where you are, your conditions, your doctor, and which makes more sense for you. But since I'm making a blanket statement that could potentially help most people, in most cases, Medigap is a better choice. Now, if this is all too confusing and you have some discretionary income, state health insurance program has licensed agents. And do I advise you talk to one? If your circumstances are complex, yes. Let's quickly touch on Medigap versus Medicare Advantage plans. Most any doctor pretty much accepts Medicare, who will also accept Medigap. In the Medicare Advantage plan, as I mentioned, you have to be in the network. Medigap is quite straightforward. Benefits don't change, premiums do, I have mentioned. And Medicare, it's all over the place. Medigap, as long as you are in US continental, Medigap is covered. Medicare Advantage, you have to be within the network. We always go back to that limitation, network. If you have Medigap, like any other insurance policy, you get what you pay for. If you like to have the flexibility to have more frequent doctor visits, Medigap is better. If you're a healthy person, then Medicare Advantage plan may work for you. In Medigap, standardized benefits, as I mentioned, but Medicare Advantage plans, not much standardization. More stable insurance companies are in Medigap, not so much in Medicare Advantage. And I did mention drugs are not included in Medigap, but they are in Medicare Advantage plans. A few more considerations before we wrap up. So if you have an HSA, that has to be stopped if you have Medicare. You can't have an HSA and Medicare because remember, HSAs, you need to have a high deductible plan. Medicares are not a high deductible plan technically. So you want to stop your contributions because if you don't and if you continue, then you're going to have to reverse that transaction, and that's not easy. I shouldn't say that's not easy, but that's a headache. When you sign up for Medicare, remember I mentioned the premiums are based on your income. So Social Security Administration is going to look back at your records 2 years dating back. If there's not much of a difference, a lot of people do, then you're fine. But if there's a change, then you need to get ready to appeal. There's a process for that. You say, hey, my income has changed. These are life-changing events. There's a list, and change in income is a life-changing event, and you appeal and you pay less. So be on the lookout for that. And for timeline, as I mentioned, get ready at least 5 months, I would say a year. I would say when you turn in 64, make this a priority to learn, to look into the plans. And 5 months should be the red flag because there's so much to learn and decide and choose from. And if you miss, then sometimes, as I said, that's the only time you have that chance. As you know, you can always email, call me if you have any questions. I'll stop here. Thanks for watching. I hope you found it useful.